Okay, here we are back with Eric. And Eric, I think we're at about week 7, aren't we? From the beginning of our orthodontics. And at this point in time, we are in a place where as you remember, we did some minimal stripping between the lower front teeth. And we've now got everything nicely aligned. And we've just begun to condense those spaces, okay? At this point in time, Eric still has not brought, we've not brought those lower front teeth back far enough to where they clear. So when Eric is closing down, he still is first hitting those upper front teeth. And I'll show you in a moment here exactly what they look like. But if you could, Eric, just tell me the last 3 weeks or so, since the last time we showed you here, tell me what your experiences have been.
Last week I had a migraine for 2 days,
okay,
and it wasn't as intense as before, which was good, but still was a migraine. I was out of work for the 2 days. We just talked about how the teeth are touching, and newest thing that I'm finding out is I'm chattering, and my teeth don't know where they want to sit in my mouth, and I just be standing at work or doing whatever, I'm just chattering away.
Okay.
And I catch
chattering
myself,
in the sense of?
where do my teeth want to line up?
Like you're kind of trying to find out, you're just kind of playing with them in a sense, trying to looking for something.
It does it by itself.
Okay, okay. That's the kind of an unusual response. But what we're seeing here, understand, this is almost predictable that this would happen, okay? Because what's happened now, we've begun to free up the upper front teeth, okay? In other words, the front teeth aren't locked in as much as they are. They're still, as your mandible is coming forward, you're still hitting heavy on those front teeth, okay? You're still constricted, so to speak. But yet, you've come forward a little bit, and now, because of that, the back teeth aren't quite hitting evenly as they were at one time, okay? So now you have this kind of, everything's kind of messed up right now. And so what we'll find, this is very, very predictable, and I think your headache, Eric's headache at this point in time, is not disconcerting at all. In fact, it's almost predictable that this is going to be the case. And what we'll find here is as Eric's front teeth continue to condense, as those spaces continue to close up, we're going to find very likely within probably the next couple, 2-3 weeks, that no longer will you be constricted, okay? From our initial projections of how much you were constricted and how much we took off, you should be clearing those within about the next couple, 2-3 weeks. And at that point in time, I think you're going to be a lot more comfortable as far as, not hitting your front teeth and headache-wise. But at that point, you're still going to have the situation where now the back teeth, the gears in the back, because of the shift of the jaws, they don't quite mesh properly, okay? And so when we get that orthodontics done, that's when we will go in and do the reshaping, okay? We will, again, reshape those back gears by primarily a little bit of reductive reshaping, okay? Just kind of like take away from those areas that are interfering, maybe add on to some areas, and that we'll find out in the, in the next, probably the next month or so here. But at this point in time, everything is pretty much on course. This is pretty much what we would have expected. And again, probably within the next 3 or 4 weeks, probably the active phase of orthodontics should be complete. And at that time, we will go in and finish off with a little bit of additive and reductive reshaping to get those gears to really mesh together in that proper jaw relationship. And right now, your jaw is still coming forward, still seeking where to go, and so pretty much what we expected. Now, if we could, Eric, anything else? Any other experiences?
That's basically been it.
Okay.
It's been fine.
And other things, they've been moving nicely. Everything has been moving very nicely, very predictably. Let me just, for the benefit of those who are watching here, get a sense of where we have come. I think they all remember what the models look like, and you had quite a bit of crowding in those lower front teeth. And again, as we uncrowded them, in the process of uncrowding them, in reality, they actually came a little more forward and a little bit in the beginning. And now we're pulling them back, okay? And as we pull them back, that's when those lower and upper front teeth are finally completely clear. If you could, Terry, just real briefly here, if we could kind of zoom in and get a sense of where, this is one of those traps, okay, open here, and if you could look over towards Terry, close down a little bit, okay, bite down all the way. See, we have a nice relationship there, but again, Eric still complains or indicates that when he closes comfortably, he's still hitting on the front teeth more heavily. Now open if you could, Eric, real wide. I think if you can get a sense here, Terry, if you can kind of zoom in on these lower front teeth, as you can see, they're nicely aligned, very, very nice alignment. You'll see there's still a fair amount of spacing, probably a total of about 2.5 millimeters of spacing yet to be condensed. And again, that should be condensing probably within the next 3-4 weeks or so. And at that point in time, I'm very confident that we're going to be, at that time, those lower front teeth will no longer be hitting against those upper front teeth. So, Eric, any other questions or anything else at all now?
I'm fine right now.
Okay,
Great.
well, I think we'll leave it right there with Eric. And our next visit with Eric, which I'm going to guess is going to be probably somewhere around a month from now, we should be near at the completion of the orthodontic treatment. And we will then follow up with Eric when he's completed with the additive and reductive reshaping phase, and he'll be done. So I'll
Great.
see you in about a month, okay, Eric?
Thank you.
Thank you.